Chair of the Presidential Task Force and Secretary to the Government of the Federation, Honorable Ministers, gentlemen of the press, it's been a while. We missed you on Monday, so it's good to be back. Mondays are not the same without a press briefing with you. So today I thought to feedback a little bit on what we've been doing on the national strategy to scale up access to testing in Nigeria over the past few weeks. It's obviously taken up a lot of our energy, and it's important to feedback to you on where we are and where we hope to get to. A few weeks ago, I announced this national strategy to scale up our testing, and we really adopted a five-pronged approach to this. We set a target, which I made public, to test 2 million by the end of this month. But the target is a lot more than just the numbers, because testing in itself is not a goal. Our goal through testing is to bring people into care, accelerate them through the public health process, enable contact tracing to happen for those that are positive, and generally move the system along. That's the only way we can know where we are, restart our economy, live comfortably our own life. So everything about this disease is ultimately dependent on our ability to gain insights into transmission, which we need testing for. So the first point is just in terms of the number of labs. We now have 59 labs activated in 29 states and the FCT across the country. So a lot of progress. We are working this week to cover the rest of the country. Right now we have teams in Kebbi and Zamfara. Another team is in Gombe and Taraba, working to cover the country. So we're working very hard to make sure testing is available to every state in the country. There are currently 45 labs that can carry out PCR, real-time PCR across the country, and we have the rest gene expert labs activated. So 59 labs, 59 testing labs across the country right now serving Nigerians, and we're trying to accelerate this as much as possible. Now, the second prong of this five-prong approach is to leverage the high-throughput labs that already existed for HIV and convert them to test for COVID. So of the 6 PCR mega labs in Nigeria, we've activated 2 of them for COVID, the National Reference Lab and the Defense Reference Lab in Abuja. We have 1 in Lagos and Naima, 1 in Anambra, the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital have been activated for COVID testing. So that's a very important part of our approach, leveraging on existing laboratory capacity for HIV for COVID. Now, the third prong, which many of you know about, is the gene expert machines that are scattered around the country. We have over 400 of them in 399 health facilities. But the challenge is not in the gene expert machines themselves, is that we need to provide an additional level of safety. They're called biosafety cabinets in order to use this for COVID. So far we've activated 13 of them in 10 states. So pushing very hard to make sure that with that gene expert technology we can increase access to testing. The fourth point is to include the private sector in our testing architecture. So we've been working very hard with the private sector across Nigeria to include them, but they themselves have seen that it's not as easy as we might originally have thought. So we now have 5 in Lagos and 2 are almost there in Abuja. So we're hoping that once we have activated the 2 in Abuja, then we'll have 7. Sorry, there are 7 in Lagos and 2. There were originally 5. There are 2 more accredited recently, so we now have 7 and we'll have 2 in Abuja. And slowly that will increase the capacity. I heard the couple in Port Harcourt that are also making progress. So with the inclusion of the private sector, we should be able to expand our testing even further. and we'll keep building as we go along. The fifth prong of this, our strategy, is to explore the role of rapid diagnostic test kits. So we've been working with the Medical Laboratory Science Council of Nigeria to validate a number of kits. There are 2 that are showing good promise. So that validation process is ongoing at the moment. And in the next couple of weeks, we'll be able to know at least whether those first 2 that showed the most promise are able to be included into our testing algorithm. So those are the approaches we're using to increase our testing capacity. But the other challenge, like you know, is many Nigerians have been complaining about the ability to get their test results quickly. Now, there are 2 channels for this. Firstly, it's from the NCDC directly. Secondly, from the state epidemiologists, from whom you have to get your lab results anyway, just like for any other disease. So what we've been doing is create a platform, an online platform. So just like those that are used to buying JAM forms, once you have been tested and a result has been sent, you will get a code, and you can use that code to go online, download your result. If you need a printed version, be able to print it out and use it for whatever you want to use it for. So that platform is almost ready. We'll be piloting it in Abuja first, and once it demonstrates its utility, we'll scale it up across the country. So whoever has been tested can access their results once they've been notified that their results are ready through a text message that they'll get on the phones that they register with the system. So through that, we'll increase access and the timeliness of the results. So you can see from all of these how hard the entire system is working to improve access to testing, and all of this will be an incredible improvement, not only for COVID. Of course, we're implementing this for COVID, but you can imagine that all of this will serve Nigeria for many years to come, whether you have Lassa, yellow fever, in fact, any infectious disease, and hopefully we'll be able to actually roll this out for all the other infectious diseases, including TB in our country. So a lot of the innovation happening right now will serve the country for many years to come, many years into the future. So this is really to thank all our partners, the WHO, the Africa CDC, WAHO, from who we got a lot of test reagents very recently, for all their support in building our testing architecture. We're very committed to taking this forward. The Global Fund, UNICEF, so many other agencies have really been working with us to build up testing. Of course, the federal government of Nigeria has been our biggest supporter and enabled us the resources, and I don't foresee any challenge in terms of test kits in the near future, because we're really ramping up a stockpile of reagents across the country. Of course, the National Assembly has been very generous in supporting all the work that we're doing, and that is really an example of a collaborative effort across the country. But I think the most important people to acknowledge this evening are medical lab scientists that do the work. The 24 hours at the National Reference Lab, you find lab technicians, lab scientists working. It's the same across labs across the country, working in dangerous situations. Many of them have been infected themselves and have come back to work. We're very grateful for their efforts and their diligence. And I'd like to use my last seconds today to really thank all of you, all the lab technicians, all the lab scientists that have worked and continue working very hard on behalf of all of us to make sure those test results get back to patients on time and enable the entire system respond to this outbreak. So thank you very much.